Bueno, amigos de PerioMX, estamos muy contentos el día de hoy. Nos vestimos de gala aquí en el stand de Straumann, México, en el Congreso del AMP, con el profesor Giovanni Zucchelli. Giovanni, thank you very much.
Thank you to you.
Welcome to PerioMX Mexico.
Thank you so much.
It's very special for us to take your presence here, and only 3 questions. Periodontal plastic surgery, well, is a boom from today. Why?
I think that the problem is that, or the nice thing, that it started as a treatment of gingival recession around teeth.
Yeah.
And so it seemed that it was something that it was only for a very, very small amount of patients, very, very demanding patient in terms of aesthetics. But now we understood, and all dentists understood in the world, that soft tissue plastic surgery means how to manage the soft tissue, how the soft tissue will heal around teeth, and now even more around implant. And since most of the problems we had around implant, especially in the aesthetic zone, depends on the aesthetics, on not in the right soft tissue management, it is so important that we can learn how to manage the soft tissue in the best clinical situation as possible, because it's the cleanest, that is the teeth, by making mucogingival therapy around teeth, because the same surgical technique can be applied to improve the outcome of the aesthetic treatment also around the implants.
Oh, well, you are talking a lot about this, but what about periodontal disease? Because we have to...
We have to,
we have to, and we're dentists first.
What you're right is, I have to tell you that in my new book, the first concept will be why the tooth is extracted, you know?
Yeah, why?
Yeah, because it's completely different if the tooth is extracted for dental reason, which can be endodontic reason, which can be root fracture, it can be root resorption, tooth decay, but the patient is healthy. With respect to the reason why the tooth is extracted and should be replaced with an implant in the case of periodontal disease, there is an infection. And this infection has to be treated before implant therapy. So many therapy like post-extraction implant are contraindicated by definition, because you have to treat the infection first, and you cannot leave a tooth that is hopeless in the patient's mouth without removing the infection first. So patient with periodontal disease, it's a completely different patient. It's a patient that has to be treated for periodontal disease, that you have to motivate it in an incredible way in order to prevent the recurrence of periodontal disease, and when everything is perfect and the patient now is healthy as the patient in which the tooth was extracted for dental reason, you can think about the implants.
Well, we know that in Italian school has a great influence by Niemann's and in GTR, but from today, like an intravonic effect, membrane or endogame?
For sure, membrane doesn't exist anymore in terms of clinical applicability. It has been a period incredibly important to understand the wound healing, how the bone tissue heals in the regenerative procedure, but now we have such an incredible surgical technique that are able to give stability to the blood clot. The only thing we have to do is to improve the blood clot capability to be transformed into new bone, into new cementum, into new periodontal ligament. And the only material we have that biologically can induce the regeneration is endogame.
Because Italian school published in the past a lot of, like a rubber dam.
Yeah, it was, but you know, it was the period, you know, that we understood everything about regeneration. And it's thanks to that period that now we changed.
Okay, only a few questions and briefly answers. Toothbrush, manual toothbrush or power toothbrush? What do you prefer?
At the beginning, after surgery, manual should be absolutely necessary, because you have to be so soft, so cytospecific, that I cannot rely on, let's say, electronic, how do you say it, or not
powered, ultrasonic,
or whatever it is, toothbrush. After the healing, it's no problem. You can use whatever you like, because you increase the thickness, and in relation to the manuality of the patient, that they can use the power on the manual. In the lingual aspect, palatal aspect, and the occlusal aspect, the patient can use whatever is more effective for the patient.
For a pre-implant sulcus, what do you prefer? A plastic proof or metallic proof?
I would say something that is smooth the maximum is possible, because when you are in the sulcus, it's much more dangerous for plaque colonization than the possibility to have some kind of adhesion. So I prefer as much as possible metallic, obviously, if you are able to increase the thickness of the soft tissue in order to mask them.
Yeah, and in another way, because we know that enamel matrix derivative M2 has a lot of potential to induce. So what's your opinion about PRP?
I think that PRP is a completely different concept.
Yeah, but there's an idea that
PRP does not make any regeneration of the root.
No.
Does not induce any cell transformation into cementoblast, fibroblast, and osteoblast. It's something that improves wound healing. Maybe in the future we can also say that it can increase soft tissue thickness, but this is nothing in terms of periodontal regeneration.
You are a very active person around the world. What things we have in common? Because we read a lot of Europe, we read a lot of America, but in countries like that, like this, Mexico, Latin America, we were talking about it. What is in common here? What do you see around the world? Because you go to Asia, you go to Latin America.
I think that now the desire of knowledge by the young dentist, the young periodontist, is something that really make the all countries the same. That is something I can really feel, and I have to tell you that here in Mexico, this feeling was incredible, important. It was really something that you immediately feel when you are here. Very, very young people who wants to improve their knowledge, and this is something that I think it's our future.
This channel, PerioMX, is a social media channel, and we know that you are very active in social media. What do you prefer, Facebook or Twitter?
I have to tell you that it's not me personally that dedicate to this topic. I have some person that works for me. I think that now you cannot stay far from the social media, because everything is social media. You don't have to exaggerate. I have never published one of my clinical cases, so it's not a way to publish. In order to publish, you have the literature. Facebook could be a right way to make people know, in order to make advertisement of your courses, of your activity, of your person if you want, in order to know how people is in general. But I judge a lot people according how do they behave in the social media. When people publish and think that they can make people know what they do by Facebook or Twitter or whatever it is, I don't think this is the right way.
So a message for our students in our world, from Latin America students, from Mexico students that follow you a lot, a message please?
Continue to do what you are doing, because I saw here that you have such an incredible enthusiasm and such a good teacher that for sure you will improve so much that the distance, let's say, from what it was in the past and today is really getting shorter and shorter.
So in that words, we have a gift for you. This first book in 30 years in Mexico was made for 20 authors, Mexican authors, for the best university and the historic university in Mexico, National University of Mexico. And this is for you. It's in Spanish. It's a point of view that we see the periodontology and implant dentistry, and well, you are referenced there, and for us it's a honor to, in your hands, our book.
Thank you so much. It will be a pleasure for me to read, and then I will give you my personal comments on this, okay? Thank you so
Bologna
much.
or Juventus?
No, this is a question I don't like to answer, because there is only one team in Italy. This is called Bologna.
Thank you very much, Giovanni.
You so much. Thank
Gracias a todos en PerioMX. Seguimos aquí con el doctor Giovanni Zucchelli en el stand de Straumann México. Seguimos acá. Thank you very much.
Thank you so much.